Hey guys, so today I'm going to do a quick guide on blood flow restriction training and give you a little bit of an idea about what it is. So what is it? Essentially, blood flow restriction training is a form of training where very light loads are used, typically 20 to 30% of your 1 rep max, and that is combined with occlusion of the limb being trained in order to promote a very hypertrophic environment. So occlusion essentially means that we are stopping blood from actually leaving the muscle, therefore we get a pooling of what's known as metabolites. So these are the byproducts of contraction. This causes, like I say, a very hypertrophic environment. It induces some cell swelling, and this tends to show increases in muscle gain that are similar to those expected from using much higher loads and much lower rep ranges. So who would benefit from this? Well, obviously bodybuilders and those searching for maximum muscle gain could certainly benefit from doing this kind of training. It helps reduce loading on the joints and still provides the same kind of muscle growth as you would see from using much heavier loads. It could also be very useful for those returning from injury because it still allows a muscle building kind of stimulus on the muscle without putting too much tension on the tendons and ligaments, and it can actually have a bit of a rehabilitative effect by obviously inducing blood flow towards those types of connective tissue. So very useful for bodybuilders, very useful for those coming back from injury as well. Another benefit of blood flow restriction training is it typically tends to see much lower levels of muscle damage after performing it compared to performing much higher intensity, higher load training. This means it could be very useful during deload periods where it's not going to give you that same level of muscle damage ongoing. It could also be very useful for those actually returning to training who perhaps may need to go through a bit of an intro period due to the amount of muscle soreness they may get from just jumping straight back into some heavier loading. Factors to consider. If muscle strength is your main goal, so if you are, say, a powerlifter, this should be used sparingly. The reason for this is because that those who train with very low intensities versus those who train with high intensities, whilst they may see similar gains in muscle strength when they're training to failure, typically those who train with higher intensities do see greater strength gains than those training with the lower intensities, so using say 20 to 30% of their 1 rep max versus those who are training with very heavy loads. So for powerlifters, something to be used sparingly, perhaps to allow the joints to recover, but it should not be your main focus with your accessory work. So another factor to consider with this is to not use it too often. So in this study by Wilson and Loneke, what they found is that those who were doing blood flow restriction training 2 to 3 times per week saw greater gains than those doing 4 to 5 sessions of blood flow restriction training per week. So ideally, you do not want to do more than 1 or 2 sessions per muscle group using blood flow restriction training, as you may see actually a reduction in your potential for growth. So now what I'm going to do is give you some practical advice down on the gym floor on how to utilize this type of method, what things you should be doing and what things you should not be. So the first thing that we need with blood flow restriction training is some cuffs. You don't need anything fancy, you can pick them off Amazon for pretty cheap. However, some of the thicker ones are much better for training the legs, as these ones can be a bit overstretched, especially if you've got particularly big quads, unlike me. So they should only be used when training the limbs, okay? So you can't use it for anything like the chest, it just won't work. You can only use it for limb training, so you could use it for anything from the shoulders down, and typically when you're training the arms, you want to have it around what's known as the delt insertion. So it's basically called the deltoid tuberosity. It's just where the shoulder goes into the upper arm. Then tightness, you want to tighten it at about 7 out of 10, okay? So you don't want it so tight that you completely occlude any blood from leaving, because you'll soon know about it, it won't feel particularly good, but typically about a 7 out of 10 is what you're looking for with this. So, exercise selection. Once you've got the bands on, you've got them tightened to the right amount, what you need to do is you need to be making sure that if you're training the arms, the hands and the elbow are below the heart, okay? So if you're training triceps or biceps, you need to make sure that the hands are below the heart. This means that gravity is going to allow blood to come down into it. If you do it essentially, say, lying down with the hands above you, doing something like a skull crusher, what will happen is gravity will actually help blood leave the muscle, and you won't get the same effect. Same for lower body. Ideally, you want to have the foot below the heart. So something like a leg press is not going to work particularly well for blood flow restriction training. So, good options, any form of curl, not lying curls, because obviously if you're doing a lying curl, the hand is level with the heart. As I mentioned there, not doing any kind of form of skull crusher, because the hand, once again, is above the heart and the head. And same again, not using the leg press, because that won't work quite so well either, or even lying leg curls won't be the best choice that you could possibly do. Okay, so what kind of rep range do we need to work through? Well, the approach that's used in most research is essentially 30 reps done with 20 to 30% of a 1 rep max, followed by 30 seconds rest, and then 3 sets of 15 with the same weight with 30 seconds rest in between. However, there's no magic to this. Essentially, all you need to do is work at a particularly high rep range, taking it very, very close to failure. And then as you get more fatigued, you will essentially notice that reps will typically tend to drop down because of the kind of acidic environment that's being built up in the muscle. So you can do 4 sets of 15, you can do 3 sets of 20. Doesn't really matter. The idea is just essentially to keep blood actually into the muscle and promote that kind of acidic environment.